I have heard so many stories from my patients and those on social medias where people feel like they are being dismissed and not heard in their appointments. With delayed diagnoses and being yo-yoed between healthcare professionals, this can have a massive impact on our physical and our mental health and also lead to a mistrust in healthcare professionals and the system. I know the system is stretched and failing to provide adequate and timely care. And being a doctor on social media at the moment, I feel like the narrative is a very us versus them approach. And I want to try and bridge that gap and actually give you realistic tips and empower you on how you can advocate for yourself in your appointment and be heard. Because ultimately, as a doctor, it makes me so sad when I hear these stories, and our job is to help people. So I want you to think of this as insider knowledge. And hi, if you're new here, I'm Monika, also known as Dr. Mon. I'm an NHS GP in London, and I've been a doctor for 8 years now. I share my life inside and outside of the clinic online, and I'm here to be a credible and relatable source of science-backed information to help you live your happiest, healthiest, and best life. Okay, there are a few things we need to talk about, and I think we need to lay our cards out all on the table before we get into it. And the first thing is that medical misogyny exists. There is misogyny in medicine, and it's leaving women in pain with conditions undiagnosed for years. There is a lack of awareness and understanding around women's reproductive health conditions among healthcare professionals, and I think that's because of the second issue. And that is that there is a profound lack of research in women's health. Women weren't included in clinical trials until 1993, and most of the medicine I learned at medical school was based on clinical research done in men. And that's because women were seen as too complex because of factors including our hormones. And now, when we essentially have a women's health crisis, all the research and the funding unfortunately isn't in our favour. Which means people don't understand when women are in debilitating pain, that means that they are missing school or university or taking time off of work, because the research to support it is only just beginning. Now, on the other side, for years, the government has failed to meet targets to recruit enough GPs. But now what's happening is that trained, fully qualified doctors aren't able to get consistent jobs. And the reason isn't because of an excess of doctors. We all know, and I'm sure can agree, that we need more, but it's actually due to the chronic underfunding and lack of investment in the healthcare infrastructure. 84% of GPs across England actually struggled to find a consistent job, which meant that many of them were reconsidering their future in the NHS and the medical profession altogether. But it's strange because the narrative has always been that there is a lack of appointments and it always falls into the lap of the GPs and we aren't working hard enough, but we just don't have the correct support and funding that we need. Which leads me on to the actual appointments. So most GPs, myself included, only have 10 minutes per appointment, and I will hold my hands up and say that that is not enough time. The actual guidance says that we should have 15-minute appointments with no more than 25 patient contacts per day, but the reality is that many of us, myself, I am seeing 36 patients a day with 10-minute appointments. And I feel a massive pressure when I do my clinic. I always think, am I able to give the quality of care and attention I need to my patients in those 10 minutes? Am I going to be able to go through everything that they are concerned about? Is it safe to send this patient home? What if I miss something? There are so many things that go through my mind in those 10 minutes for each patient, and it ends up being me just firefighting and running on adrenaline for the whole clinic. Okay, now that all our cards are on the table, let's get into the tips. The first thing I want you to do is become the master of your body. I always say to my patients that I know the human body, but I don't know your body as well as you do. When you start feeling a symptom or you feel like something isn't right, I want you to keep a diary of it and start asking yourself questions like, when did it start? Was it a gradual or sudden onset? Is it there all the time? Does it come and go? Have you done anything that makes it better, or have you done anything that makes it worse? Are there any other symptoms that happen at the same time? And how is it impacting your life? And please, 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 as a PSA to the girls, I want you to track your cycle. I always say that the menstrual cycle is an indicator of health, just like your sleep or your heart rate. So if there is one take-home message from this, then please track your cycles. The second tip is do your research. I want you to do your research, and I know a lot of people say don't ask Dr. Google, and I kind of agree and disagree. I want you to do your research, but I want you to look for credible sources of information. Did you know 1 in 3 people use social media for advice? And I want you to be really careful because your favorite wellness influencer may not know the science or explain the science behind what they are asking, explaining, or selling to you. Instead, look at the credentials of the person. So do they have a degree to support what they're talking about, or is this their area of expertise? The information they're giving you balance. So when I speak to patients in clinic about a treatment option, I will always give them the pros and the cons and the risks and the benefits. You also want to look for medical evidence, but know that they have been able to critically analyze the data that's out there. So lots of papers are out there claiming lots of different things, but they have limitations. So sample size or confirmation bias or cherry picking, because all of this can actually affect the results. The third thing is that I want you to write down what you think is going on and more specifically what you're worried about. And then I want you to bring it up within the first 2 minutes of your appointment. This is because then I'll know how to best assess you, but also decide if I think it could be this, what investigations you need going forward. And if I don't think it could be this, I can explain to you why and provide some reassurance. The fourth thing is that I want you to write down what you want out of this appointment. And it's okay to be specific because it just means that we're on the same page. It can be anything from reassurance to blood tests to certain scans to trial of medications to even an onward referral. Number 5 is that I want you to take someone with you to your appointment. I always say to my patients that they are so courageous when they come to their appointment because you have to be so vulnerable in front of your doctor about your health and your worries. Taking someone with you can help give you that support and help you advocate for yourself. It can also shed some light on how they have seen the symptoms affect your day-to-day life. The next thing is that it's okay to feel like you need more time because we are probably thinking that too. What you can do is ask for credible sources of information to read outside of your appointment. You can book a follow-up appointment to discuss the reading that you have done and also discuss how your symptoms may have changed in that time frame. And you can also ask for specific worrying signs that you need to be aware of. And the last thing is that I want you to know that it's okay to ask for a second opinion. I will absolutely hold my hands up and say that I don't know everything. There are times where I will book a patient in with someone else for a follow-up, for a second opinion, because maybe that GP has more experience than me, or they have a particular area of interest in a condition that this patient has. And as a doctor, I think it's so important to know the limitations of your knowledge. If I don't know enough, I will always ask someone who does or refer on to a specialist who does. But I appreciate that this isn't everyone's experience, and I want to empower you and let you know that it's okay to ask for a second opinion. I hope this has helped bridge the gap between doctors and patients because honestly, I'm getting quite worried about the narrative I'm seeing online. I know the research is lacking and I know the system is stretched. I know that the trust in doctors is reducing, but I'm hoping this video has given you some insight into my reality as a healthcare professional and empowered you to advocate for yourself in your appointment because ultimately we care and want to help you. If you've made it to the end of this video, then thank you so much for watching and I will see you next time. The end. That was a lot of talking and now my mouth hurts.